Hi, my name is Angela Ariano, and I'm a licensed marriage and family therapist practicing in the state of California. Today, I want to go over the topic of what will the first session of therapy even look like? Please bear with me as I'm kind of reading from my notes, so it might not be professional, but this is just going to be a comfortable, casual format for people that are wondering if they should go into therapy, what it's like, and how those steps will be like. Hopefully, I'll get into what my modalities are and how I practice. But before we get started, I want to mention that this video is just for general educational purposes. It is not at all considered therapy or any type of diagnosing. This is just kind of general observations that I've made, how I practice, and I don't want this to be considered any type of diagnosis or any type of formal therapy. So let's get into the question of what is the first session of therapy actually like? Well, hopefully even before you get into your first session, most private practice companies and even like companies do some type of consultation before just to see if you're right for it. So hopefully you get that. Those are typically free, but it really depends on insurance and how that person likes to practice. But let's say you've met with them, you're like, yeah, this seems like a good fit. Let's get into it. So what is the first session going to be like? So let me tell you this, a lot of people are nervous, and I think that's really understandable. It makes a lot of sense, and that is very valid to feel. But it shouldn't, I won't put it that way. I'll say it is a time just for you to even see if this is the right therapist for you, and the therapist to see if, is this someone that I want to be able to, that I can help. A big thing therapists try to live by is the phrase in my scope of practice. So in all honesty, I do not have a lot of experience working with people who have disordered eating. So if someone comes to me and really wants to work on whatever disordered eating they have, I would be very honest and say, this is not a field I have a lot of practice in. I'm willing to work with you and help you, but I want you to know this is not my area of expertise. And I would be able to, I actually have friends or facilities that I can say, you can go to these ones, but if you feel comfortable and safe with me, that is your choice. That is something you might hear in one of your first sessions. Another first thing you're going to hear in the session also is the therapist is going to be talking a lot because we're just going to have to go over all of the kind of informed consent. So policies and procedures and payments, those are all things that you'll hear. That is kind of by the state of the laws that the state has for us, and just kind of ethical good practices to let you know what happens if I need to cancel, if you need to cancel, how many missed sessions, if you're running late, how maybe notes are kept. Those are all things, and those are times for you to be able to ask that too. Like, hey, what happens if you are in an accident and you can't see me for a while? Most therapists are going to have some type of backup plan so that you're taken care of in those cases. So ask the questions you want to ask. You can ask your therapist, are you more of a casual? Are you a structured therapist? What modalities do you use? These are questions that you can definitely ask, and a good therapist, in my opinion, should be able to answer all of these. All right, what the therapist is going to want to know from you also is, hey, tell me about yourself. What brings you into therapy? And as therapists, we know that this is a hard thing to share, so there is a lot of compassion and time given. Know this too, you do not have to give all of your trauma right away. That is something for sure. If you want to, if that's what you need to do, you definitely can. If you are in a place where you're like, I need to know if this is someone I trust first, share what you're comfortable sharing. And I would encourage you also to be like, it's going to take me a while to be able to feel safe and let you know. But I'm coming in because I just can't sleep, or I'm having trouble with my relationships, or whatever it is that you want to come in with, you can let them know. You do not have to share everything that you are not comfortable yet sharing. All right. Some of the things I might go over also as I'm looking at my list is just the diagnosis. So this is kind of a stigma. We really don't want to have those labels put on us, and I understand that. Unfortunately, the way, especially if you're going to go through your insurance, most insurances are going to want to see that there is a diagnosis being treated. It's this phrase that we're not always a big fan of, but it's medical necessity. So let's kind of think of it in the mirrored shape of like if you have a cold, if you have the flu and you decide to go to the doctor has to say, okay, seeing patient for a cold, for bronchitis, for whatever it is. We can think of it that way. Just because someone has bronchitis doesn't mean they're a bad person or something negative about them. And that's how they're going to bill the insurance. The insurance knows that what you met for is being worked on, the medication or whatever is going to go through. The same is going to happen when you go to therapy. The therapist is going to ask you what's been going on, and they might give you some type of diagnosis of, of course, like generalized anxiety, depression, even just some type of just transitional life thing going on. Try not to let those really affect you. These are just minor things. People don't ever have to know about it. Think of it as, like I said, you have a cold, you're being seen for a cold. Just because you have that label on you does not mean anything other than you're just going through something right now. Another thing you might be able to go into within your first session, it's a lot, all these things, and then hopefully be able to work on the goals. Maybe you're coming in having trouble sleeping and a lot of anxiety. So maybe the goal will be decrease anxiety, learn coping skills, and get better sleep. This just helps the therapist when they meet with you to be a little more direct and know what you're working on. Sometimes we want to go into therapy and just talk and talk, but then the therapist also wants to make sure, hey, you're here for a reason. Your money and your time is being spent. Let's make sure we know. So the first session might also be goals. You do not have to know your goals. You do not have to know the modality. The therapist is there to figure that out, but I want you to know going into your first session, kind of not knowing what to expect is hard and scary. So knowing they're going to go over all these things, we have a list of questions and a way to kind of get the conversation going and help you that can help with that. Some of these things are because of insurances, how we really have to do that. Let's summarize a little bit. It's okay to be nervous. That's actually expected. Something unknown can be really scary. Another thing for you to keep in mind is we want to make sure this is a fit that matters. So it's okay to meet with a therapist and then be like, you know what, actually, I don't like your energy. I myself am a little more personable. I tend to try and use humor. I like to do art sometimes. I'm not going to force a person to. Other therapists are going to be very much of that like kind of classic stoned wall, like I'm not going to let you see any of my personality. And maybe that's what you need. So it's kind of getting a feel for what it is you want, and you might not know. And we can get into maybe another video down the road what it can look like if you're like, oh, I think I need to fire my therapist, and how that can go. So I hope this video was helpful in any sense of the word of your first session is going to be, it's okay to, let's go there. It's okay to be nervous. It's okay to not know what to say. Your therapist is going to go over a lot of policies and procedures and housekeeping. They're going to ask you a lot of background questions, and this is just for us to get a concept of who you are. A diagnosis might be given depending on the insurance. Try not to let that affect you or upset you in any way. It's just a way so we know, okay, this person has this diagnosis. We're going to go in this direction, as opposed to like, I don't know, I'm just going to talk. It helps us be able to have a case conceptualization for you. I really hope this video made sense. Let me know if you have any questions or if there's anything else going on in your life that you might need help with on Is Therapy Right for Me? Bye.